everyone. Today here we are with Dr. Shilpa Domkundwar madam. She's a hardcore clinical radiologist, a teacher by choice, and she always mentions a dean by accident. So she is currently holding the position of dean at Government Medical College of Dharashiv, little sister place to Solapur, and with a lot of requests. Why? Because she's so humble that she thinks that she's not too perfect or not up to the mark, and she doesn't want to be a public figure anytime. And I remember she quoted to me, "I am not the person you will find me on Google," and those are the real gems whom we can have and get blessed with their knowledge and experience. So welcome madam, today we have you here at 31st December, and we are lucky enough to celebrate a kind of English New Year or the Eve with such legends and practically living people. So moving ahead with a few questions ma'am. Of course these won't be much academic but more medico-social. So moving on to the first question, we talked about AI technology, and as already you are a hardcore teacher, just some concluding point which you would like to make, or maybe informally we have discussed it many a times, की ह्या दोघांची जी सांगड आहे, how these two things can go parallel and they can have a common consensus and we can have good outcomes out of them.
See, at the end, it is a doctor-patient relationship, and in between the two, there is a knowledge. It is dissipation and interpretation of knowledge to be used for the betterment of patient. So AI is just a medium. It may be a better medium, it may be a faster medium. It may be better in many ways than the human intervention. But as of today, we don't see it replacing the human portion of medicine. It may make the technological portion of medicine more accessible, efficient, affordable for the patient. But the human element of connection with the patient, that's your empathy, your concerns, your identification with the patient's psyche, and your bedside presence. These are the things which no technology can replace. The day that is replaced, I guess that will be a world between man, humanoids, and machine, all going haywire, or all. I mean,
that's chaos.
The whole idea of having a human touch and the element of compassion, what we talk of in the teaching world as the ADCOM theory, is nowhere related to how you implement it. AI ultimately is a tool.
It's a good servant, not a good master. We can.
It is a good servant. I think we should never allow it to become a master.
I remember the 3 principles of robotics that you mentioned, and this is a very key point which included it.
Yes, the whole idea of creating a machine man is that he will never overpower a human being, but he will facilitate all those things which a human computation will lack in efficiency, in speed, or in quantum. Now, you can't put this speed, quantum, and efficacy to emotions, compassion, and empathy, because these are still very abstract science. And as I told you, for all the similarities, the synapses are far different. The parallel computing between a human and a computer is still way away from each other. So I don't see them overlapping at this stage at all. But since he says, I quote movies, I quote novels, I quote stories, because I still feel that these are the best mediums of learning. When I have to sit in a classroom and learn something, I tend to forget. But the same thing when I go and see in a movie, it sticks. When I read a storybook which I like, then things stick into me. And of course, your generation is more of a visual input. Our generation grew up with big books. So those books gave us a lateral window to imagine things which were written. So books were not similar for everybody. The same book had a different story for every other person, which depended on his capacity of imagination. It's like, वो कहते हैं ना, न्यूटन खाली बैठा था इसलिए एप्पल नीचे गिरते हुए देखा. अगर वो बहुत बिजी रहता था तो दिखता ही नहीं था. The whole idea of telling is your mind should have space to imagine. Rather than rote learning or exam oriented question, there has to be conceptual imbibement in the whole process during your 5 years. If you are not understanding, and see, the human machine, it's a machine, so it has a flow. There is a mechanics that's going in, so it's a story in itself. If you see how you live, how you breathe, how the heart works, what is digestion, you're seeing all those videos these days, right?
Yeah.
How this happens. What is that? That animation is actually the story of your body. So anything that comes as a story is always welcome, because it's the best way of learning, either storytelling or listening to a story. So that's why I am ingrained in finding similes in your study with stories. And the next popular form of story that everybody is magneted to during your 15 to 25s, that is cinema. Of course, I wouldn't say only Bollywood or things. Cinema is huge. And today with, again, your digital platform growing in, it's become really huge. Popular cinema on one side, your sci-fis on the other side, there are beautiful documentaries coming out, and it is your imagination which can find similes in anything. You find similes in anything. Like, I'll tell you, there was a time when we did zoology or we did our botany and we wouldn't remember the names. Our teacher would say, गाली आती है ना? हाँ, तो बोले नई गालियाँ सीखो. दिन में ना जो क्लास में सुना है उसको गाली बना दो, उसका मतलब समझो और सिमिलरली गाली बना दो, जी याद हो जाएगी. And that helps.
Like a mnemonic
it sticks with
competition.
you. Mnemonics, today mnemonics also, they come ready-made. They come ready-made, and then again you are by-hearting them.
No, but the ones
But the
which,
flow,
yeah.
but the flow helps you. So in general, I would still say, look at your study as a story. Always look at it as a story. First, because it helps you to remember. Second, because it helps you to gain concepts of the various processes that happen in your body during normal physiology, during a pathology, during a disease or reversal. Those stories, conceptualized and understood, will let you pass the best of the MCQs, will let you pass any kind of ECQs, or with exam. See, exam will be a technique which will help you to refine your stories. But if you don't have stories learned, then you don't have a good exam coming in. One. And medicine in general is beyond getting a degree. It is understanding and practicing. Degree is just a license for which a particular method of exam is being trained. That is not the end, rather that is the beginning of a new era. And to make yourself ready for it, you need to know the story of health, disease, the physiology, anatomy. And your generation is very fortunate that you have got a lot of freeware that helps you solidify your concepts on the visual part with everything on Google. I remember spending hours trying to understand how a muscle goes from one place to another, because we did not have anything else. We used to dissect the wrong way, understand the muscle when we had cut it the wrong way, and then go home and sit and then imagine on each other, try to pull and say, okay, this was your biceps, okay, this is like this, now try and do it. Today you have animations of anything and everything which can be flowed, rotated. So your learning times have come down significantly. But what is lost in that is your assimilation has become superficial. So you tend to forget things.
Yeah.
And why? Because everything is so very in platter very obviously seen that you understand it very well, but you cannot retain and assimilate it, for which you need a repetitive training. See, whether it is AI or whether it is human synapses, it needs repetitions.
Memory.
So all said and done, we still need those 3 repetitions before we go for an exam. We still need those multiple. Only the ease is, when I used to forget, I had to carry my Harrison all around. Today I can carry the Harrison in my phone.
Lakhs of Harrisons.
Yes. It
That
was
is the
difficult
scope.
to scroll through Harrisons. Today I can put a keyword and the Harrison will give me everything and everything on the pages that's there. I can surf out literature easily, but I still need to understand the mechanism of stories if I have to apply all this to real type scenarios. So exam is not the end of everything, it is a means towards the real cause, that is patient care.
So as a aid, this will be a boon. And if we are just relying on it, I think
it is definitely a boon as a aid, but it is definitely a treacherous choice if we want to replace ourselves. I mean, man is the only animal probably who is relentlessly laboring to create mechanisms to make himself extinct. And it is, I don't know, see, modern medicine doesn't acknowledge this concept, and we all know that then we go from the realm of science to metaphysics. When we say, where does your soul lie, who are you, and is it the heart or the brain that dies? So these are technical things which can be answered in medicine, but when we think of human existence, it's all a realm of metaphysics which is not addressed in medicine. But that's what makes the difference between an artificial robot and a human being. Tomorrow I may find synapses that may have excellent parallel computing and may come too near human feelings, but we still don't know whether they will be able to
really do what we are.
They will be able to dwell into the metaphysical existence of man. So they say metaphysics, science and philosophy, we don't know where they blend and where they remove. So in that case, we still can keep up and say that science in its best of the capacities should be used for the upliftment of mankind, not for the replacement of it.
So this was a brief elaboration about the question, and I think it covered a lot many points. It touched. It is like we discussed about the lake which has so many villages on its border.
See, he's learned storytelling. There is no time.
That's the impact of the aura. So
and there's another thing that I find I should be telling the newer generation is, you learn best when you teach. So how do you enhance that? Group discussions, exchanging chapters within yourself,
some competitions,
teaching the juniors. No,
competitions in the sense not in terms of prizes or like that. Competitive way of I mean studying.
Okay, Antakshari khelo. But what I mean to say is, you read a chapter, I'll read a chapter, I'll teach you, you teach me. Informal interactions. See, we learned in medicine 2 places. One was near the bedside and second was in the canteen. That's where we got our follow-ups, that's where we fought with each other, that's where we told what we read and what you know. So that human exchange, again I'm coming to this, that human exchange which is getting extinct unfortunately in medical schools by the name of preparing for exams in the MCQ pattern, is actually detrimental to your learning the subject in general. Because at the end, it's not the exam you're preparing for, you're actually preparing for a real life scenario where you're going to treat patients. And apart from the ATCOM skills, what you need to learn there is exchange of knowledge, discussions, healthy discussions beyond your egos of competition of marks. I mean, you may have got great marks, but there is somebody who else is far better at computing the situation at the patient bedside, and he may later on become a better doctor than your marks. So there are multifactorial.
Yes.
It's very multifactorial. Your marks don't define who you're going to be as a dog. What will define is your exchange of knowledge, your interpersonal relations, and all this is enhanced when you learn by group discussions. One. Secondly, when you learn by teaching your juniors. And the third thing that I would say is, see, we talked of AI, where we talked of data which is going to be fed and the algorithms are going to become stouter, and in all this what is important is handshakes. See, if I don't have handshakes between two synapses, if I don't have handshakes between two nodes, there's no data transfer happening. Similarly, we need to have handshakes between seniors and juniors.
Mental handshakes.
Yes. See, we learned the conventional way, where my senior held my hand and made me confident enough that so that he could run away. And because he wanted to run away, he would teach something which would take 3 months in 15 days, would train me in maybe 3 weeks, make me efficient before time, and take his spare time out. In that, he trained me well, he put me to real-time tasks, and he found his own freedom. That was called as responsible withdrawal. Today what is happening is, these handshakes are with your, unfortunately, ChatGPT. It's not, the handshakes are between, again, a human and an AI, but not between two humans. So your parallel computing as a community of medicos is going down. If we have to strengthen ourselves, our handshakes have to be not only with the technology, but we can't afford to lose the conventional handshakes between two human beings, because then you're becoming technology dependent, which at this stage is only very monocular. It can be exciting, it's monocular, but it can be detrimental, because what 10 human beings together can imagine or do, maybe one machine may do it efficiently, but may not be able to imagine that well.
But what I feel is the genesis cannot happen there.
Exactly. See, the hand holding is needed for progression. A machine to man progression should not happen at the cost of man to man synapses.
Exactly.
So what you have to learn is, I am going to see the videos, but then I'm going to go and discuss it. I am going to learn, but when I have to do a revision, I will do it with my juniors so that they all as well learn. And the newer generation is a smarter learning generation. So, I mean, I learn most of my technology from my kids, from my nephews, from my students. So, obviously, you're going to learn many things from your juniors. And today, your generation gaps are like, आजकल के मेडिसिन के लोग तो 2 साल को जनरेशन गैप बोलते हैं.
Yes.
तो 2 साल के जनरेशन गैप में तो जूनियर जनरेशन के पास बहुत सारी ऐसी चीज़ें हैं जो सीनियर को पता नहीं है.
Which we were able to elicit today as well, but from the other end. But still, the thing is.
Learning is handshaking with the machine, handshaking with the technology, without leaving your solid human handshakes. That has to be there. Otherwise, we will become so dependent with the technology that when it gets flawed, when it gets monocular, there is nobody else to give a broader vision. I cannot depend on a machine learning to correct me into another machine learning. So I need a human learning side to side with the machine learning to deliver the best in me.
So, with this discussion, not taking much of your time, in one statement, if you would like to quote something in regard to this topic, you would like to quote something to young medicos in a statement which we can take as take-home message.
Well, you want a one-liner. One-liner is a difficult thing to create. It comes spontaneously.
Yeah, and it will come. Be sure.
Use your technology with your real friends so that you can give real patient care.
Yeah, man. So basically, technology as an aid with human relations, giving a human touch, if we can reflect it correctly.
Yes.
So thank you so much, ma'am, for giving your time and coming all the way from Dharashiv to Solapur and bearing us since morning and accepting every small request and wish of ours and being so humble and kind to us, a good guide, a good guardian, and a good motherly figure to us.
See, students are the responsible energy. Any human being responds to energy. But when it is students, it's a lot of responsibility. If I don't stand up to their expectations, the loss is as much mine as theirs.
This is a deep thinking, madam. What we are talking about, deep learning in AI, no? This is a deep intellectual, emotional.
I would definitely say that I owe it to this guy who has persuaded me, otherwise I was extremely reluctant to come. Because I'm a lazy person, honestly. He made me study after so many days.
No, I'm happy that.
And I would definitely say that somewhere I got back to my old days कि चलो मैं पढ़ाई कर सकती हूँ. And yes, of course, I got to meet some wonderful people around, which otherwise I would have had to travel to places to know. So your choice of your guests was excellent. You really got blessings from the best of the field. They have come all the way down, and if Talwar sir can come from Delhi, I have no excuses to.
From Dharashiv, Delhi to Dharashiv. So.
But yes, it has given me a perspective that if students decide, you can have a guy from Delhi come back all the way to Solapur just to honor a student's wish.
And
because he was an old timer.
Yes.
He was an old timer. He was glued to what I called the human empathy. I don't know whether a techno-savvy younger would really take the efforts to come down, and that's where exactly I'm trying to tell is the batch that needs to be bridged.
That human touch. And no, all the way. Last time also when he had been here, we had a one-to-one conversation with him, and म्हणजे अतिशयोक्ति नहीं, not speaking much, but he became very sensitive 3 times during a 15-20 minute discussion on this topic कि यार ये human touch, empathy. We still have the recording with us, and I mean as a person who saw 5 decades in this practice, 7 decades, 8 decades, he's 77.
See, with all the technological advances, with all the availability of things, how much has translated really to improving patient care? The scale in which things have changed, have they brought the same amount of positive change in patient care is something which the younger generation needs to ponder on. See, it's very nice. वो मोबाइल में वहाँ पे रख दिया तो हार्ट रेट आ गया, पल्स आ गया. But what you do when you touch a patient and take a pulse to yourself and to the patient is an irreversible connection between two human beings. That thing called faith that is developed from that, I don't see any technology developing that.
Yeah.
And we cannot miss out on that, at least today.
Human abstractness cannot be replaced.
As of today, I don't know. I depend on the younger generation and their imagination to come up with new algorithms or possibilities of how things would be later on.
No, but then still, anyways, even today, science has gone leaps and bounds. But then that consciousness, it cannot be figured out because it is something which is to be sensed, or what I feel. And I think you would agree with this as well.
So these are gray areas of human existence. You keep on going and watching. But yes, those gray areas make life as human beings meaningful. Not only to us as professionals, even for the patient. And once you understand that, you will understand the need of connecting with the patient in healthcare. Otherwise, healthcare automation can be anything like running an airport, going to a quest, going to a food industry, ordering things.
But it is not simple.
I don't see it happening that way, because when I am in pain, I need somebody sitting next to me, holding my hand as much I need an analgesic. And that has not changed from the very human existence till date.
There are studies likewise if that empathic sympathetic part is more prominent, opioids within will release and work as an
The biochemistry of empathy we still have not studied. But that's what they keep on saying now. When they do research on the physiology of yogis and physiology of weird people around, and they find things, or then when you try to say happy hormones and this activity causing this release and dopamine is this and that,
serotonin,
so all those things are the biochemistry or the technical aspects of an abstract feeling. Now, does that mean I make a robot which knows when to create dopamine and serotonin and he feels what I feel? Is a distant imagination.
No. Generations have come, generations have gone. Like bygones is the poet. So it cannot be, unveiled.
See, these kind of discussions beyond the realm, they can continue for hours together with no conclusions.
Yes.
So what I would suggest at this stage is understand that technology is aid, not a replacement to your own efficacy, to your own empathy, and to your human connections. So, as you learn your subject, also inculcate the ability to practice it as an art. And when you want to practice it as an art, everything else becomes a tool, and the human connections are what will make it different from an efficient technology. So, we cannot today barter this to efficiency of technology. Rather, they have to be simultaneously used rather than exchanged.
So this is the take-home message that is very prominent, and I think in the 3-4 questions we discussed it prominently, it is like the cream on the milk, and we will definitely have it as our take-home message so that we have happy and satisfied lives and in patient care as well. So thank you again, ma'am, for being here, and we are really very happy to have you here, and we had a very good time and a very chapters of different abstractness that we could learn by everyone being present here. म्हणजे एकमेकाला ते शोभून दिसलं, म्हणजे एकमेकाला पुरेसं होतं. And very very thank you, ma'am.
Thank you.